I think the question is this a drug effect or a class of drug effect? And of course, with Idelalisib, we've got much more data from the randomized trials and the ones that were ongoing earlier on. I think it's fair to say that the toxicity is immune toxicity, either immune suppression or autoimmunity, and that's worse in patients earlier on in the disease. So frontline patients with a more active immune system have a problem. I think with Duvelisib, which is a gamma delta inhibitor, it may or may not be tarred with the same drugs. We just don't have the data, and we're hoping over the next few months to collect the data we have in several hundred patients that have been treated with that drug. And then there are one or two other specific delta inhibitors that are more immature. My guess is that they'll like to have a similar problem, because I think it's probably a class effect. I think when the news broke about Idelalisib, I was chairing a meeting for Gilead at the time with 500 hematologists who'd used the drug. There was a sort of acceptance that it had toxicity, but we can deal with it. And I think it will find a role. We have patients who are now relapsing after BTK inhibition, having problems of intolerance, and therefore there is a role for PI3 kinase inhibition, but it's just finding it, I think, is the challenge.